Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we're here again, and this time I would like to focus on med moments. The last show we focused on sharing and caring, but this time med moments. And what's a med moment? A med moment is that instant that the body is telling you that something's wrong. For instance, if you're walking up a flight of stairs and you get chest pain, that's a med moment. Your body's telling you that something is going on, that you need to see your doctor. And it's important that we not ignore these med moments, because little med moments develop into big med moments, and then it comes down to an emergency room visit. So don't ignore your body. Your body gives you clues as to what's going on and when something's wrong. Take heed. Notice the med moments. Go to your doctor. Take care of yourself. Okay. Also, Facebook. We're on Facebook. It's live, guys. And Facebook is Obey Your Doctor. Come on. Follow me on Facebook. We're posting a lot of educational stuff, a lot of stuff about weight loss too, and getting fit. And for the summertime, you got to get that bikini body. So Obey Your Doctor is the Facebook, as well as the website, obeyyourdoctor.com. We have so much medical information and good things to know about as far as the website is concerned. So check it out. All right, let's talk. I just mentioned weight loss. So understand, well, I want to talk about the Let's Talk segment. I want to talk about decreasing our cholesterol and our saturated fats. But weight loss, to me, is the key to health. If we could decrease the general population that is overweight, if we could decrease them by 10%, we decrease hypertension, diabetes, heart disease, strokes. There's so many diseases that would come down as far as incidence is concerned, and people would be so much healthier. So let's drive towards weight loss and a healthier you, okay? So the American Heart Association, it gives us some hints and some ideas on how to reduce the risk of coronary heart disease. And that's basically the arteries getting clogged with cholesterol plaques. So some of the things they recommend: limit your cholesterol. So those products or those foods that have a lot of cholesterol, limit them. Don't eat a lot of them. Limit your whole eggs, meaning that you should not eat more than 3 whole eggs a week, okay? Skim milk is good, all right? Skim milk or 1% fat milk is better than whole milk, all righty? Avoid foods containing saturated fats like lard, and understand saturated fats are fats that at room temperature are solids. Polyunsaturated fats and monounsaturated fats are the good fats that we should try to eat more of. If you're going to eat fat, they're the ones that are liquid during room temperature. So you're talking about things like soft margarine or vegetable oils or olive oil. These are the ones that are polyunsaturated fats. They're the ones that we should eat, as opposed to something like lard, which is a solid during room temperature. Okay, eliminate or I should say decrease the amount of organ meats, such like liver, because they have a lot of cholesterol in it, and decrease your processed meats like hot dogs and things like that. So these are some of the things that the American Heart Association has given us, just a list of things that can help decrease the cholesterol. That way we can decrease heart disease. All right. Our main topic for tonight, we're going to talk about kidney failure and what can we do about kidney failure, the treatment of kidney failure. Kidney failure is a very common thing in the United States, and for many reasons people lose their kidneys, and we want to go through all of those reasons tonight. I have the perfect person to cover this topic, and we're going to cover it from A to Z. This physician, he's a nephrologist, and a nephrologist is a specialist dealing with kidney disease. Tonight we have Dr. Nando Palakar. Dr. Palakar, welcome to the show.
Hi, Dr. Bay. Thank you for calling me.
Yes, yes. And thank you for taking the time to come on the show, because this is such an important topic. Number one, an interesting topic. Number two, I'm sure you would say that. And I just want people to know more about the kidney, because it's something that the body needs. It's something that has a big responsibility for the body. And if we can take care of it and how we can take care of it and prevent the failure, it's just so important. So let's just, and what I'd like to do is just a quick review. Let's do a quick review. So what does the kidney do for us as far as the body is concerned?
So Dr. Bay, first of all, we have two kidneys, most of us. And they are the main responsibility of the kidney is to make sure that the internal environment of your body is maintained at all times. So when I say internal environment, what do I mean by that? I mean that you drink a lot of water a day, right? If there was no way for you to get the water out, you would just blow up. So it is the responsibility of the kidney to make sure that it keeps you in water balance. So the amount you take in generally is the amount you will urinate. The other things is all the foods that we eat and the general, the way the digestion happens, and it all creates waste products. And those waste products are also excreted by the kidney in the urine. So the urine is a composition of water and waste products. And by doing that, the kidney maintains a harmony within your body of all the elements, the sodium, the potassium, the water, and all of those things. And it continuously does that every minute, every second.
It balances
everything out.
So what we're talking about is at the cellular level, our bodies. You know, we're like a chemistry set. And I always think of it like we're a billion cells, and all those cells are communicating with each other. But in order to communicate with each other, they have to have the right amount of sodium, the right amount of potassium going in and out of the cell.
That's right.
And if that's not happening, we're in trouble.
We are in big trouble.
And the kidney is the one that regulates all of that for our body.
That's right.
Interesting, interesting. Renal failure.
Right.
Okay. It's a big word and a complicated word, but just kind of simplify it for me. What do we mean when we talk about renal failure?
See, renal failure is a really broad term. It essentially indicates that your kidneys are not working right.
Okay.
And there are degrees of kidney failure.
Oh, all right.
Yeah. So in the olden days, we would just say, oh, you have a kidney dysfunction, it's not working properly. But nowadays, there are stages. There's stage 1, stage 2, stage 3, stage 4.
Right.
So stage 1 being the most normal kidney function that you would have, and stage 5 and stage 6 being the most distressed kidney function that you have. So most people who are in stage 6 are in dialysis.
Okay.
Patients who are in stage 5 are ready to go into dialysis.
All right.
So that is how the kidney function is staged at the present time.
Okay, okay. Two diseases that I always hear about when anybody's talking about renal failure. You got to get these two diseases under control. It's diabetes and hypertension.
Absolutely.
Tell me about these, how they terrorize the kidney.
Absolutely. I have to tell you, Dr. Bay, that there are 50% of all dialysis patients right now are diabetic, and their kidney disease is because of diabetes.
Right.
Okay. Then there is another 15-20% of them that have kidney disease purely from high blood pressure.
Right.
And if you have a combination of diabetes and hypertension, and if you don't take care of it, it becomes a real big problem over time. So the question you have is, how do we take care of it? Right? So listen, if you have been diagnosed to be diabetic, you have to make sure that you follow your diet, take your medications, and don't miss your medicines, and do the right things and lead a healthy life. I mean, you were just talking about diet just now. A lot of that is what is necessary if you have diabetes. And then you take your medicine, and you have to check your sugar. And you have to check your sugar every day. And there's a 3-month test called hemoglobin A1C that you need to do to make sure that your hemoglobin A1C level is as close to between 6 and 7 as possible. And if you do those things right from the beginning and you control the diabetes, you eat right, the chances are you'll delay or prolong or may even prevent kidney disease. And the same thing with hypertension. The problem with hypertension is a lot of patients will not even know they have hypertension.
Oh, all right.
Right? So it's a silent killer sometimes. So the minute that's why it's important that you get your blood pressure checked when you start getting in your 30s, late 30s, early 40s and things like that. And if you do get diagnosed with high blood pressure, you ought to be treated for it. And there is a little misconception, as I've been doing this practice, I find people saying that, oh, I'm on 5 medicines, I don't need 5 medicines. No, you need your blood pressure controlled. And if it takes 5 medicines to do it, you need the 5 medicines.
Right.
So that is the 2 big principles of care for diabetes and high blood pressure.
Right. So that's so important, because the amount of people that have those 2, and they're chronic diseases.
Absolutely.
It's what, like, once you have them,
they never go away.
It's not magically going away.
Right.
So either you take it seriously and take your medicine and do what you need to do and follow up with your doctor, and whatever he tells you, follow that regimen, or the likelihood of having at some point in your life kidney problems
Absolutely.
is high.
Absolutely.
All right. What about symptoms? All right, as far as kidney problems and stuff, like, what symptoms am I going to have?
Okay.
Am I going to have?
The thing with kidney problems is there could be no symptoms, right? There could be. I've seen patients who show up in the emergency room with absolutely no symptoms and kidneys completely shut down.
Oh, goodness.
But in addition to that, there are a few symptoms. If you pay attention, there are a few symptoms, right? So you might start feeling fatigued, tired early. Your skin may start to itch a little bit. Your breathing becomes difficult. Sometimes the things that you could normally do, you can't do right now. It takes you longer to do those things. These are all non-specific things, but they can happen. It can affect your heart. It can give you something known as inflammation of the pericardium, the lining of the heart.
So inflammation means swelling around the heart.
Swelling around the heart. And that can happen with advanced kidney disease.
Right.
But with kidney disease progressing from stage 1, the symptoms may not be that obvious.
Okay.
Yeah.
Alrighty. I know that they always say that there are certain races that are prone, and I happen to practice in an area that African Americans is a large component of the population. So it's very concerning when we see so many people with kidney disease. Tell me about that as far as race.
I mean, the African Americans are more prone to kidney disease. Okay. There has been new research that has been done on it, that they have found a mutation in the gene. Okay, which means that there is a mistake in the way the gene got formed, and that mistake is more likely to cause kidney disease in the future. And this particular mistake in the gene is seen in about 14 to 15% of African Americans.
Interesting.
So they are prone to kidney disease. They are also prone to diabetes.
Right.
There are other illnesses that are more common with African Americans, like sickle cell. So that again contributes in kidney disease. There are other populations that are also more likely to have kidney disease. There are the Hispanics are more likely to have kidney disease. They are more likely to have diabetes, which then leads to kidney disease. Native Americans have higher prevalence of diabetes and thus kidney disease.
Right.
So that is true.
Okay, all righty. There's an association with anemia and the kidney. Tell me what, and anemia being that low blood count. Right.
So the kidneys make a hormone called erythropoietin. Okay. We call it EPO. And that hormone is responsible to stimulate your bone marrow to make the red cells.
Right.
Now, when your kidneys don't function well, the amount of that hormone gets less and less and less. And beyond a certain point, say your kidney function has now declined to about 35-40% of normal. At that point, you start seeing that effect in your blood test where you are now anemic.
Right. All righty. I want to move along
Sure,
because
sure.
we got a lot to cover.
Hurry me up.
Yeah. So 24. The kidney is like a 20. So what you're saying is the kidney is like a 24-hour cleaning crew in our body.
Absolutely.
It's always cleansing the body, and that cleansing is being excreted out into the urine.
Absolutely.
All righty, all righty. Now, we had talked about the potassium and the sodium, that it balances that, but it also does other things as far as our body is like a chemistry set. And acids and bases.
Right.
How does the kidney regulate the acids in our body?
So, by the way, how do you get acid? You get acid by what you eat, right? So you generate acid. A lot of meat products, if you eat, you generate more acid. If you are a vegetarian, you generate less acid. So it's the kidney's job to get rid of that acid. Because if you don't get rid of the acid, just imagine what will happen inside your body with all that acid.
Right.
So what the kidneys do is they have this complex mechanism to get rid of acid. And every single second that you are living, the kidneys are getting rid of acid little by little by little. And generally, they balance it out to the amount of acid you put inside your body through your food.
Okay, all righty. Now, I understand that all you need is about 20% of one of your kidneys working, and you could probably do okay as far as renal function. Am I in the right ballpark with that?
I would say that you need about 20% of both the kidneys.
Both kidneys
Both
working.
the kidneys.
All
yeah.
right.
So of total kidney tissue from both the kidneys, if you were to look at the function, about 20% will allow you to live a generally healthy life.
Okay. So we have a lot of reserve.
Absolutely.
All righty. So you can imagine how badly we've treated our kidneys if they've
right.
totally failed, because there was that much reserve there initially,
Right.
and we've gotten it down to less than 20% of each one.
Correct.
And we're really feeling symptoms.
And then one thing I want to add here, though, Dr. Bay, is that once you get to the point where you are down to 20%, there's not a whole lot you can do, because it just then continuously deteriorates over a period of time.
Okay. All righty. Let's talk about treatment.
Okay.
All righty. Now, I understand that dialysis is one type of treatment, and transplantation or kidney transplant is another treatment. Let's start off with dialysis, okay? Tell me about something about this magnificent machine that we see sometimes.
Dialysis, there are two kinds of dialysis. One is the hemodialysis, which is the machine you're talking about, the big one, and the other one is the peritoneal dialysis, which we do through the belly. So the hemodialysis is usually more commonly done because people don't really like to do this peritoneal dialysis, as they have to do it at home themselves.
Right.
But the machine dialysis is done in a center where they will take care of you 3 times a week.
Right. So the thing of it is that, now explain, give me a little bit more detail. Peritoneal, let's start with peritoneal dialysis, just to
Right.
explain
so
it.
essentially, if you look at your belly as a pillow in a pillowcase,
okay,
and you put a little tube in the space between the pillowcase and the pillow,
right,
and you bathe that space with a sugar solution, which is what we are doing.
Oh, okay. So you actually put a solution into the space around
that space
between your in your
that
gut area there.
That's right. And you leave it there for about 4 hours. What the solution does is that it extracts all the poisons and the toxins and the fluid.
So it pulls all the poisons into that fluid area.
And then you get rid of the fluid, say 4 to 6 hours later.
So you open up the drain and drain it out.
Drain it out. Yeah. And then you keep doing it. In the case of one kind of peritoneal dialysis, you do it 4 to 6 times a day. And then there's another variation where you do it at night with the machine, where the machine keeps doing that for you. And then you do maybe one exchange yourself in the day. So that's peritoneal dialysis.
Okay.
So when you go to hemodialysis is essentially, there is a filter that the blood passes through.
Okay.
Okay. So you take blood out of your body, you pass it through the filter, and then you give it back to the body.
Okay.
Now, in the process where the blood is passing through the filter,
right,
the poisons and the toxins and extra fluid is removed out.
All right.
It comes into contact with this thing called dialysate, which is a clear solution with no toxins in it.
Right.
And there is an exchange that happens in between the two solutions.
Okay.
And the dialysis gets all the waste products and the blood cleans up.
Okay. So
And
the
it goes
blood's
back.
going past the dialysate.
Correct.
And the dialysate is saying, hey, give me all
Give me
your
all the
waste.
bad
Give me
things.
all your
That's right.
toxins. And it's just
That's right.
flowing across. And then once the blood goes past, then the blood is pretty much free of toxins and
That's-
it goes back into the body.
That's correct.
Interesting. Very interesting. Now, I know that sometimes when patients get renal, their kidneys aren't working, there's something called uremia.
Right.
Uremia, and they get confused and they can have seizures. Tell me about this
So
part.
thankfully, Dr. Bay, that is something we are seeing less and less and less.
Okay.
But what that means, the uremia means, is that you have let your kidneys fail and not taken care of that, because that is the ultimate state of kidney disease.
Okay.
Okay, you could be gently uremic or you could be severely uremic.
Okay.
And there is this whole
I'm sorry.
spectrum. There's this
There's
whole
a full
spectrum of uremia. So the small uremia with the early uremia is a little nausea, a little loss of appetite. You don't sleep at night.
Right.
That's the early nausea. As it gets later, your thinking gets muddled up.
Oh, okay.
And then your chest starts hurting. You might even lapse into a coma.
Yeah. Just from the kidneys.
Just from kidneys,
Right.
not-
And that basically is the toxins building up into
That's correct. In the brain.
into the brain. It
Yeah.
goes across the membrane
blood-brain
and gets
barrier.
into the brain, and the toxins
Right.
affect your brain.
Right.
Oh boy. Oh boy. All righty. Talk about fluid. Now, I know you said that the amount that we drink and the amount that we urinate has to balance and
Balance.
equal.
Right.
So if we're giving medications such as medicine to make you urinate and you're not urinating, then the fluid builds up.
Right.
How much fluid can you take off at one time with the dialysis? Is there a problem with taking too much off at one time and stuff like that?
Oh, that's such a good question. And absolutely, I'm glad you asked this question, because the most common mistake that patients make when they come for dialysis is to gain too much fluid. Okay, so we generally tell patients not to gain more than 1.5 liters or 2 liters, which would be what, half a quart, half a gallon, right? No more than that. If you gain any more than that, it's hard to remove that fluid out of your body in the 3 hours or 3.5 hours that you are in the dialysis center. And then you start getting low blood pressure. Some people pass out and then have to be revived. Some people have to be given fluid back again, so it works against you.
Right.
So the idea is to not gain more than about 2 pounds in between dialysis.
Oh boy. So being on dialysis is not simple.
No, it's not.
I mean, you have to watch what you drink.
Watch what
and
you eat.
And I understand another thing. Just tell me about this. A lot of patients that have kidney failure like ice.
Yes.
You know, and that's a problem too, because ice is water.
water. Yeah.
Yeah. So
Yeah.
how do they control that? Is there a way that
It's
they can?
you know what, I say all these things, but I understand what they're going through.
Right.
Okay, one of the things that happens a lot is thirst. They are constantly thirsty and the mouth is dry, so they need something to keep it wet.
Right.
All I can say is that minimize it.
Yeah, right.
Okay, it's hard to do, but it needs to be done. And eat less salt, because if you eat less salt, then you're not as thirsty.
I understand. Now, I understand that other things too. Between dialysis, you had dialysis today, and maybe 2 days down the road, you're going to have dialysis
Again,
then.
right.
Tell me about some of the elements, or like potassium, or that may increase, and some of the secondary effects because of increasing, like heart problems and stuff like that, that you have to look out for.
Right. So you worry about potassium in dialysis patients, right? Because potassium has a very limited range that it can stay in your blood. If it goes too much beyond that range, it can cause your heart to stop. And that is really something that is easily preventable by following the appropriate diet.
Right.
So if you follow the right diet, you wouldn't get into this kind of situation.
Right.
And it does affect your heart, and it's a big problem when that happens.
Alrighty. So the thing, when you're talking about diet, you're talking about specifically not high potassium foods.
Correct.
All right, because there are certain foods that you know, they'll say, oh, eat a banana because that has like people who have blood pressure
Right.
problems,
Right.
and their potassium may go down, so they have to eat a banana. Someone who's on dialysis, you would say,
Don't eat a banana.
Don't eat any bananas.
Don't eat any
Stay
banana.
away from bananas
Right.
and oranges.
Oranges,
yeah,
yes,
things like
melons,
that. Oh
yes.
goodness, because they have a lot of potassium
Yes,
in them.
yes.
So diet is always, so there's I should say a disease-specific diet
Absolutely.
for these particular
Right.
patients. Very interesting. Okay. Great. Toxins. Dialysis is used sometime in the hospital. There are certain toxins that somebody may take a overdose of something that can be extracted out of the blood because of by dialysis. Tell me about that. Is that used very often?
It's usually used in products which can be removed by the membrane.
Okay.
Right. So there are not every toxin, not every poison can be removed by the dialysis membrane. There are certain specific drugs and toxins that can be removed. So in those particular cases, yes, we do use them.
You do use it, huh?
Yeah.
Okay, then. So we talked about peritoneal dialysis, the types, and hemodialysis. That sometimes you can actually put a person on a machine and only clean the blood and not take fluid out of the blood.
That's possible?
Possible as well?
Yes, we can do that. But generally, when patients are on chronic dialysis, they will need both.
They will need the fluid to come out as
also,
well as to clean the
toxins
out.
Yes.
Okay. All right then. Well, let's talk about quickly, because oh my goodness, we have so much to talk about. Let's talk about the access real quickly.
Yeah.
Access meaning that like a shunt that they put in for the dialysis patient.
So I tell my patients that the best friend you have in your life, other than your wife, obviously, is, or a husband, is an access.
Right.
Okay, a good functioning access can take care of a lot of problems that you would otherwise face.
Right.
It is very important to create that access early enough in your stage of kidney disease. So if you start going from stage 3 to stage 4, you should start thinking of putting an access inside your arm.
Right.
And it's really important. If you don't do that, you end up in an emergency room really, really sick, and then they have to put catheters in your neck.
Right.
So the access is very important.
Very important.
Yeah.
Okay. We got probably about a minute to go. Let's talk. Yeah, I know time flies, doesn't it? Maybe 2 minutes. Renal transplant.
Yes.
Tell me something about the transplant and the kidneys that can be put in to save a patient.
So the kidney transplantation is probably the best modality for treatment of kidney disease. The kidneys usually go in this area, we call the inguinal space, and we don't really remove your own kidneys. Your own kidneys are in the place that they are. We leave them there. We just put the kidney right here. We connect it to the bladder from the front, and the incision and the wound sort of heals in about 7 days' time. It is probably the best way to treat kidney disease. There are two kinds of kidney transplant. One is called the living donor kidney transplant, and the other one is called the deceased donor kidney transplant. So the living donor kidney transplant is by far the better way to treat.
Right.
So because you know the person, you are more matched with the person, you know the health of the person, and the kidney is removed quickly and put inside you. So it doesn't have too long a waiting period on ice or things like that. So it works really well and works right away.
Right.
Yeah.
Okay then. Dr. Palakar, we're going to have to end right there. Thank you so much for coming in. I trust we had more time to get into a few other aspects. And thank you very much.
Thank you, Dr. Bay.
We're going to have to get you back as usual because you're a wealth of knowledge. Okay. Remember, never institute any change in your medical care until you see your physician. Sharing and caring, remember, share your knowledge with others, how you're doing better, how you're seeing your physician. It's all good because that way they can do better as far as their medical care is care is concerned. I trust each and every one of you continued good health. I'm Dr. Obey, and this is A Moment in Medicine. Until next time, peace to you all.